My name is Pieter Vermeersch. I work at the University Hospitals in Leuven, where I'm the head of the mass spectrometry platform. At the University Hospitals Leuven, we had the privilege to already have a peak view at the I601. We believe that that can be a great improvement for routine core laboratory operation. We currently already perform mass spectrometry or core lab. The same laboratory technicians operating the cobas platform are also operating our mass spectrometry solution for immunosuppressants. But this homemade solution is, however, still relatively cumbersome, requires significant sample preparation, and is also susceptible to technical issues. We believe that the I601 can significantly improve the sample flow by allowing automated sample preparation, and that this will improve our turnaround time and our response time for the routine parameters. Moreover, if this solution would allow random access availability of a number of less frequently requested therapeutic drug monitoring parameters that we are currently only offering, for example, daily or 3 times a week, when we can do these in random access, that will greatly improve the possibilities for our clinicians and clinical pharmacologists to do therapeutic drug monitoring and dose adjustments. We currently already have relatively short turnaround times for our routine immunosuppressants, but for the less frequently requested parameters, the turnaround time is in fact around 4 to 6 hours, which is, from a certain perspective, unacceptably long, in the sense that sometimes results comes in too late to already adjust the dose the same day. The automation will significantly improve the turnaround time even further, certainly for less frequently requested parameters, but it will also, from an operational perspective, improve the flow. The availability of a high throughput automated mass spectrometry analyzer would help us not only to achieve shorter turnaround times for parameters we are already performing daily, but also allow, due to the random access possibility, to achieve short turnaround times for a whole set of therapeutic drug parameters. This will greatly improve the possibilities for therapeutic drug monitoring and will help, in fact, improve patient outcome. It is not possible for all therapeutic drug parameters that we are currently offering to perform these on a daily basis and on a 24-hour-a-day basis. That's just not possible. We need a random access solution if we want to achieve that, but it is not possible to let's say, make this ourselves for using mass spectrometry. When we look at the impact of clinical mass spectrometry on patient outcome today and in the future, we at UZ Leuven think that clinical mass spectrometry is already essential today for clinical toxicology and inborn errors of metabolism, and a selection of therapeutic drug monitoring parameters for which there are no assays available on immunoassay platforms. More particularly, we believe that clinical mass spectrometry is the future for endocrinology and therapeutic drug monitoring. For endocrinology, clinical mass spectrometry will offer not only better accuracy, but also lower limits of detection, and will offer the possibility to offer routine measurements of, for example, testosterone and estradiol in patient groups for which there are currently no IVD solutions available using immunoassay. Clinical mass spec is also essential if we want to measure some of these steroid hormones, in particular, for example, estradiol and testosterone in children, for example, or postmenopausal women. Moreover, clinical mass spectrometry is also certainly the future for therapeutic drug monitoring. It is important, if you want to improve patient outcome, to look also at the major impact of drug toxicity in patients. And therapeutic drug monitoring is an essential part of improving the outcome of patients, particularly in intensive care. Clinical mass spectrometry will give us the ability to offer 24/7 a whole range of parameters, much more than we are currently offering, and will allow us to offer these parameters also with a better accuracy at a faster turnaround time than we are able to offer today.